WW1. Well, we're back in the Element Well studio. Dr. Katherine Pannell is our guest. She's a DO and medical director at Right Track Medical Group. Good to see you there, Doctor. Thanks for coming in.
Always good to see you.
So we got Thanksgiving tomorrow, holiday time, always difficult for those who have lost loved ones or who are suffering from a depression or any other sort of mental health issues. How do we need to handle this?
You're right. I mean, the holidays are great for some, but there's a large number of people that for them the holidays are really a difficult time. It's a time for some to an anniversary of the death of a loved one. Some might have recently lost a loved one, so they're grieving, and it's hard for them to find happiness in the holidays. And I think like you and Rhino were talking earlier about just avoiding things. You can't avoid things, but you could. I think communication. It can solve a lot of the issues beforehand if you go ahead and communicate how you're feeling and let them know that you're not feeling happy during the holidays, and let them know how they can help you and support you.
Yeah, I just my personal situation. I'm blessed. Everything's great. But of course, I'm a human. There's been times in my life where I've been stressed and suffered, not chronic mental depression, but you get down. But here's what I notice. When you have the holidays, you have more free time. Your mind is not as cluttered. When you're going 90-0 in your daily activities, you're taking care of your household, your business, your job, etc., it's like your mind doesn't have time to wander into that. It's when you have these holidays where you're sort of down and away from all that, where all those kinds of things creep into your head. Am I describing that?
No, you're absolutely right. Free time is time for you to sit and actually really think about it and have those feelings, whereas you're right, when it's not the holidays and you're at work or at school, you're distracted, so you're not thinking about it. I think one of the worst things you can do is isolate. I know during the holidays it's easy to do that because you're not going to work and you don't have places to be, but the holidays are probably the most important time to be around people, your support system, your family, to let them support you and help you.
Is there anything that we should be looking for as family members, friends, of people we know have just experienced some tragedy or some hardship, some trauma in their life that we can key on to know that we just need to be there?
Absolutely. Yes, there are definitely telltale signs. Family members, friends, sports members, they know their loved ones the best and what they are normally. If you start noticing a change in their behavior, their personality, if they are isolating more, if they're not taking care of themselves as well, not doing things that they once loved, or if they're preoccupied with death, like having those conversations more, it's important to reach out, connect with them, and let them know that you're there for them.
Yeah, you see that, and people are concerned about that, because if you're not aware of that, you don't sense that, and you don't, I guess, get involved or be by their side or just check on them, it could develop into something even worse, right?
Yeah, absolutely. I don't think people fully realize how important it is for connection. Like, just letting someone know that you care and that you're there for them goes a really long way. I know there's sometimes a fear that if you ask someone, are you suicidal, that you're going to put that thought into their head and that they may be increased risk of committing suicide if you bring that up. But that's actually completely opposite. That's a myth. That bringing that up and making sure that they are safe and they're not having thoughts about harming themselves is actually very preventative.
Huh. Okay. Well, I didn't know that. So, and I think most people probably did. And that kind of goes against the grain of, I guess, of conventional wisdom and common thought. Is that true?
Yeah, especially with kids. I think parents think that if they talk to their children about suicide, that they're going to give them that idea. When in fact, people that are contemplating suicide, they have been depressed for a very long time, and they have been thinking and planning for a much longer time, and that's not the case at all.
Okay. Yeah. It's a big problem in this country, as is mental health as well, is it not?
It is. And then, I see an increase in appointments during the holidays. People with mental illness, they like 60% report that their mental illness actually gets worse during the holidays.
Yeah. Do you think it's because of what I described? It's the downtime or the fact that
it's multifactorial. I think right now, it's the dark season. We just had that time change, so there's an increase in seasonal affective disorder. For some, the holidays are just very stressful. Like I said, there's grief that can be a factor, but also financially, they may not have the means to get gifts. And if you're like me, I do all the cooking on Thanksgiving, so that can be stressful. But that's where it's really important to start planning and putting things into place so that you can make the holidays easier.
You know, what about social media and the impact here, Dr. Pannell? Because everybody, of course, me included, you like to share.
Sure.
That's what it was originally designed for, honestly,
Sure.
was to share these sort of family gatherings and family activities. Is it possible that in doing so, other people maybe that don't have that same sort of personal situation with extended families, it depresses them perhaps?
Absolutely, because we don't post things that are unflattering on social media often. Like, I'm not going to post the burnt turkey. I'm going to post the beautiful table setting and the happy family, and not the live video of us all fighting over things.
Yeah.
So for people that are looking on social media, they get this expectation that that's how the perfect holiday is supposed to be, when it's not reality.
Yeah.
Nothing's perfect.
Well, it reminds me of the old Styx tune, right, Rhino? Fooling Yourself, when Dennis DeYoung, the author, the composer, talks about, don't believe what you see on TV and the magazines. And that was 40 years ago. Yeah. Now it's social media.
Yeah, social media has definitely made that worse. And the holidays, Thanksgiving and Christmas, you've got to have reasonable expectations. It's not going to go perfectly.
So we just got to keep that, I guess, in proper perspective.
That's exactly right.
Is the main thing. Is that yeah, you're right. That's a good point. We're not out there. We're not out there sharing our failures, right? We're going to share our successes.
That's right. You're absolutely right.
And that's fine, except to the extent that maybe those who see that it further triggers depression.
That's right, because they feel they can't live up to those expectations.
Yeah, that's I can definitely see that.
But I think that's why social media is so impactful for our young kids too, because it's hard for them to differentiate the reality versus what's not reality, and they really want to try to measure up, and it's unattainable at times.
How do you advise your clients with respect to that? Because that has got to be something I'm thinking that since you've been practicing has evolved into even a bigger factor that you have to consider, I would assume, when you're counseling patients. How has that changed?
I just advise to have reasonable expectations, and let them always remember that the people don't usually post the hard things, the bad things. I mean, social media, they post what's pretty and perfect, and just have those expectations, but also limit social media use. I know that that's so hard, but yeah, I mean, we are all consumed with social media, always on our phones, and we need to have time limits and don't be on it all the time.
Yeah. We got legislative session right around the corner.
It's coming up, so yeah.
Anything in particular you'd like to see our state government do?
They've done a really good job over the past 2 years really focusing on mental health and increasing access to mental health care. So I hope to see more legislation. Representative Sam Creekmore and Felsher, they're doing fabulous things, and they're consulting the right people and coming up with really sound legislation to improve access to care. And then, I'm still talking about Kratom, needing to get those things off the convenience store shelves that are harmful, especially to our teens. So I hope that they'll find some sort of legislation to either get those substances off the shelf or to have a better screening process to keep them from ever hitting the shelf.
Well, speaking of which, it has the enactment of legalization of medical marijuana. Does that change your practice any?
Not mine at all, because I'm not one that certifies for it. But I think there was an expectation that if we did the medical marijuana program, that we would see a lot of the black market marijuana use going out, and it's not. It's just as bad. I think medical marijuana is pricey, so those that were wanting to use it are still seeking it out on the streets, which can be deadly because we're seeing so many things being laced with deadly substances like fentanyl.
It seems like we're headed in this country eventually for legalization of recreational marijuana, right?
I think you're right. I think that was the ultimate goal in all of it, honestly.
Yeah, it seems like that. It failed in Florida, but the threshold was 60% for that ballot measure, but it got like 57%, so the majority of people do support that. Might see something like that make its way to Mississippi eventually as well.
Maybe. And, I have mixed feelings. I don't love that, we're calling marijuana medicinal. I don't think it is medicinal. So part of me thinks, I don't want it to be confused that it is okay and safe. So maybe legalizing is the way to go, so that, I don't know, as a physician, I don't want the owners of prescribing it, honestly.
I understand. Well, we appreciate you coming in. It's great insight and great advice and very helpful for our audience to understand the situation, especially around the holidays. I hope you and your family have a fantastic
Thank
and
you
happy
so much.
Thanksgiving.
Happy Thanksgiving.
Yep. Dr. Katherine Pannell has been our guest. We're coming right back in the Element Wealth